Ladies and gentlemen, doctors and professor, good morning everyone. It is a great honor for me to be participating in the 12th UITM Dental Student Scientific Symposium. My name is Hania Dewanto and I am an undergraduate dental student in Universitas Indonesia, and today I will present a poster about my research with the title of Analysis of Factors that Predict Indonesian Dental Students' Interest to Use Teledentistry with Professor Yuniardini Wimardhani and Dr. Anandina Irmagita as my supervisors. Teledentistry is a new innovation that can facilitate access to treatment and education in dentistry during the COVID-19 pandemic, where interaction between individuals are being limited. Teledentistry can be used for diagnosis, consultation, post-treatment monitoring, and also for lectures. There has been an increase in the telemedicine users at the beginning of the pandemic, or in the year 2020, which reached 50% more than before the pandemic. This shows that teledentistry has a great potential to be one of dental treatment and dental education tools in the future. Final year dental students, who will graduate in 1 to 2 years to become dentists, will play an important role in the implementation of future dental care, including those through teledentistry. Based on a model that was proposed by Venkates, individuals' interests in using a system are influenced by their own characteristics, such as age and gender. Therefore, the study was conducted to determine students' characteristics' influence on interest in using teledentistry, and to also determine students' knowledge about the application of dentistry. Based on the Unified Theory of Acceptance and Use of Technology model, or the UTAUT model that was previously mentioned, an individual's interest in using a system are influenced by their own characteristics and also by 4 main constructs, and those 4 constructs are performance expectancy, effort expectancy, social influences, and facilitating conditions. A questionnaire was then created based on this model, and later on Al-Abdullah et al. Modified the questionnaire and made it specific to teledentistry for their research about predictors of dental students' behavioral intention use of teledentistry, and this was the questionnaire that was used for the study. The study was already ethically approved by Komisi Etik Penelitian Kedokteran Gigi Fakultas Kedokteran Gigi Universitas Indonesia, and we conducted this study using a cross-sectional analytic design which is held in Faculty of Dentistry in all over Indonesia from October to November 2021 with an online questionnaire from Al-Abdullah et al. That before we share the questionnaire was adapted to Bahasa Indonesia through a cross-cultural adaptation, and we also did a validity test with face validity and reliability test with Cronbach alpha and test-retest reliability on 21 respondents. Later on, we conduct a descriptive analysis to see the distribution of respondents and to see dental students' knowledge about application of teledentistry in fields or departments of dentistry. We also did a comparative analysis with men-with-me tests to analyze the relationship between respondents' characteristics and their interest in using teledentistry. The data collected are considered primary data that were obtained from 472 respondents, with the population of study respondents consists of 5th and 6th year dental students in Indonesia. The exclusion criteria for respondents were students who filled out the questionnaire outside the time limit of data retrieval. The data were then analyzed with SPSS and Smart PLS program. And these are the results. Men-with-me comparative test results show that there is a significant mean differences between performance expectancy behavior with differences in the characteristic of age, gender, and voluntariness. The result of men-with-me test also showed that there are significant differences in the construct of effort expectancy, social influence, and behavioral intention with differences in voluntariness characteristics. The results showed that younger respondents may have more confidence that teledentistry can help with their work. The results of this study are in line with the findings of Lee et al., who also found that performance expectancy was higher in the younger age group. This may be because younger respondents grew up and received more education in the digital era if compared to older respondents, resulting in greater trust in technology. The results showed that female respondents had a higher belief that teledentistry would be useful for their work. This is in contrast to the previous studies, which state that men are more task-oriented when compared to women, therefore have higher performance expectancy. The result of this study may indicate that women have different attitudes towards performance expectancy, perhaps because the respondents are dominated by women, and Indonesia's dental students were also dominated by women. This can also be to the dental profession education system in Indonesia, which still use a numerical requirement system where students must meet a number of standard cases or requirements that have been set by each institution to complete their professional education, so that this system can make all dental students have a task-oriented behavior and therefore affect their performance expectancy. The result also showed that the level of effort expectancy, performance expectancy, social influence, and behavioral intention is higher in respondents who use teledentistry voluntarily. According to the technology acceptance model theory, voluntariness is one of the most important things that moderates the intention to use a system. Therefore, the research results are in accordance with this theory. The descriptive analysis results showed that majority of respondents considered that teledentistry was most likely to be applied in public health and oral medicine, with 92.4% and 90% of total participants agree that teledentistry can be applied in public health and oral medicine. Majority of respondents also considered teledentistry was least likely to be applied in oral surgery and dental forensics, with 66.3% and 60.6% of total participants disagree that teledentistry can be applied in oral surgery and dental forensics. Respondents could perceive it this way maybe because the treatment in the field of public health and oral medicine do not always require face-to-face meeting and can still be done through video calls or through electronic information media such as e-poster. In contrast to the fields of oral surgery and dental forensics, where treatment in these two fields is identical to face-to-face meeting, namely to perform surgery and also to identify bodies. According to Tella et al. And Jampani et al., teledentistry can be used in all fields of dentistry, including the fields of oral surgery and dental forensics, where for the field of oral surgery, teledentistry can be used for post-operative control and also to diagnose impacted teeth, and for forensic, teledentistry can be used for data collection and exchange. The conclusion of this study is age, gender, and voluntariness influence the interest in using teledentistry, and dental students' knowledge about the benefits of teledentistry are still limited to a few fields. Exposure to teledentistry while still in dental school could increase knowledge about its benefits and also increase the likelihood of use as a practicing provider. That is all from me. Thank you very much for your attention.